It's 0300 hours. After 4 attempts of sleep at the station, here you stand in the kitchen of a less than amused elderly man and his worried wife, who placed the call. His chest pain abated prior to arrival. He adamantly refuses to go to the hospital for a workup, despite your best attempts. You give him your best spiel and hand him the tablet to sign the refusal. He does so and walks gruffly out of the kitchen to his recliner, leaving you and your partner standing awkwardly with his wife. You just want out of there. After a few polite words, you grab your stuff and leave. As you get to the ambulance, you realize you forgot the witness signature. It'll probably be fine if you don't get it just this once, or maybe it won't. Is it really that important? I want to give you 2 tips on how to document this situation safely and properly on this episode of Access Documentation. Remember 2 things. Hi, I'm Captain Kate Cahill from your Access QA department, and we're seeing some potential issues with witness signatures in our ESO patient charts. I want to keep you safe legally and out of court professionally. So here are 2 tips on how to better document witness signatures if you aren't doing this already. The first thing I'd like you to know is refusal signatures are required by the Access Standing Written Orders. Specifically, this is covered in G9 refusal documentation, stating, "The refusal shall be signed by a witness that was present during the discussion of treatment transport options and witnessed the patient or guardian refuse further care." The standing written orders are pre-approved protocols and procedures allowed by the Access medical directors under their medical licensure. To work outside the standing written orders is to work outside Dr. Cornett and Dr. Urban's authorization. The point is, it's important to learn and work within these protocols. Gathering witness signatures on a refusal is part of that. So what's the problem? When ESO updated their program some time ago, the refusal section was altered. This was done by ESO and not by Access and created some confusion. The new verbiage indicates a witness signature is only necessary when the patient refuses to sign or signs with an X or a legible mark. However, that does not accurately reflect what is required by the Access Standing Written Orders. This is not something Access can change in ESO since it's a preset by the company. For them to realign it to our protocols would result in a change for all their clients nationwide. The takeaway? ESO changed the refusal verbiage, which is no longer in line with the protocols. Access Medical Director approved standing written orders trump ESO's can statement. So continue to grab that refusal witness signature to stay in line with the protocols. The second thing I'd like you to consider is that any layer of protection for you through documentation is a benefit. For our system, a witness signature says another party confirms what took place on that call. If any legal fallout were to occur, that extra insurance in a case of your word against another could prove very valuable. As a prosecuting attorney once told me, the less is more approach with documentation will eventually get you called to court. So do yourself a favor and make sure your charts are done as well as your patient care. So the next time you're writing a patient refusal and need to get a witness signature, please remember 2 things. First, it's required. Secondly, it's an extra layer of protection for you. No one wants to be dragged through a lawsuit. So be thorough in your refusal documentation and get all your required signatures. I appreciate your time and I appreciate you watching today. Please contact the QA officers with any of your questions or concerns. We are all happy to help. I am Captain Kate Cahill, and this has been another episode of Documentation Minute. Remember 2 things.